I understand just from what we are getting from the news that we are now over 3 million people globally that are already infected. Over 200,000 are dead. And here in Eswatini, we are now seeing a number of cases, which I think by yesterday there were just about 90 cases. We already have one death, and there are some who are reported to have recovered. So this problem of COVID-19 is a global problem. The globe is dealing with a virus that is complicated, that is serious, that actually overwhelms the body system, particularly if you have other underlying diseases like diabetes, hypertension, and others that makes you unable to cope with the disease. So as civil society, we have responded by way of setting up a committee which we call NGOs COVID-19 task team. Its responsibility is really to advise the broader NGO community, especially members of CANGO, how we should respond. And that committee has now prepared a plan or a proposal, if you like, which we aim to mobilize resources so that we ultimately deploy community actors on the ground to do information dissemination on the ground, mobilize communities, sensitize communities, also distribute information material so that people can read for themselves, and also to analyze and assess on the ground how the people are responding to social distancing, cleanliness, washing your hands with water and soap, using running water, of course, and also the social impact. Then assess the social impacts like your food security issues, your gender-based violence, even just basic human rights of people, perhaps as security forces are trying also to enforce regulations that have been put by government. So we need to be certain that those regulations that are there are not, as they get enforced, they don't undermine the people's rights. So therefore, as civil society, we want also to make sure that we up our advocacy issues, even in terms of the response itself. How is the government responding to this COVID-19? Are we having sufficient resources, such as adequate health workers and their protective clothing, etc., etc. So these are the things that we want to be advocating as we look at this pandemic. It is critical even for us as NGOs, civil society, also to be able to manage at this point in time. How do we manage our own activities whilst we also observe the lockdown and other measures that have been put in place? Those are the things that we are now also have to look inwardly, to look at how we are prepared, such as having also sanitizers in our offices, also using virtual meetings instead of physical meetings, observing all the regulations, at the same time implementing in a way differently from what we're used to some of the activities that we're doing. We are also in the process of connecting with our civil society partners globally. Yesterday, we had a virtual meeting with Civicus just to understand how globally civil society is responding to COVID-19. This disease is all about solidarity. We need to work together. Governments, civil society, private sector, communities, all must work together in order to find a common ground and ensure that we save ourselves against this threatening pandemic in our society today. Thank you.